Hi, my name is Dawn Kingsbury, and this is my self-assessment of my head-to-toe video. My video ended up about 14 minutes. I think if I knew how to edit things, it would be maybe 13 and a half minutes because of some beginning and end issues. Overall, looking at my video, I was actually quite happy with the fact that I touched on all the bases that I need to touch on. My patient had a complaint of headaches, recent occurrence, fairly sharp pain that lasts 30 minutes to an hour or so, according to his report. So I focused on cranial nerves, and I do believe that I assessed for those issues. I didn't note anything of import in terms of how that might line up with a cluster headache or something, tension headache, something like that. But again, my job is to do the assessment and then report my findings and have the doctor decide if they feel there's something there that needs to look at further. There were a couple things. I have a list here. So obviously I probably could have combined, checking for pulses, that sort of thing, and obviously in a real clinical setting, which this was not, I may have been able to streamline my approach a little more, but I don't like rushing my patients. So if you come in and you're feeling like, tick, 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 tick down the list, and you're not really listening to what they're saying, I feel like maybe that's a disservice to the client or the patient, because they might be willing to share something with you that they didn't actually come in for, that might be an alert for another situation, physically speaking. So I feel like, given the fact that I was looking at this as a neurological assessment, but then a head-to-toe assessment, I covered the important nerves and functions of my patient. I did notice some skin issues, which could possibly be related to cardiovascular dysfunction. But again, overall, I think that I did all right. Yeah, I'm looking at what, I did capillary refill, I checked for bowel sounds. Now my stethoscope is electronic, and I just push a little button and it changes it from bell to diaphragm, so that's not something you can see on the video. However, there was, listening for arterial, and I did forget to do the carotid bruise. I noticed that, and especially for somebody who's presenting with headaches, you want to make sure that you've got blood flow to the arteries. Overall, I'm going to say, yeah, I can make it a little more condensed, and I can improve my speed a little bit, but overall I feel like I did okay. And I will get better with practice, which we all do. So, alright, thank you so much.